morning, and welcome to the Ask Dr. Renee show here on blackdoctor.org. And thank you, everyone, for tuning in. Please make sure you share this broadcast. So tonight, we are continuing the conversation. I told you guys fibroids is a big deal, so we're going to keep talking about it. So tonight is also about fibroids, but tonight we have an OBGYN who actually has spent quite a bit of time in the last 6 years operating and treating people with fibroids. So if you know a woman that has fibroids, or you just know a Black woman, you should send this to her because she probably knows somebody if she doesn't herself have fibroids, because they're that prevalent in our community. So please, please, please share the broadcast. Let us know where you're tuning in from. That would be awesome. And yeah, so let's get started. Welcome. Wait a minute. Sorry. Go ahead.
Thank you very much. I appreciate it. Thanks for having me.
No problem. So Doc P, otherwise known as Dr. Pierre Johnson, is a trained OBGYN, and he is located, somebody said, where's your practice located? He is in Chicago, Illinois. And so let's just jump right in. First of all, I gave my definition of a fibroid last week because, like I said, we just had a patient on. But why don't you tell everyone what exactly is a fibroid?
So interesting. I actually just posted this on my social media stuff today. But a fibroid is basically, the technical term is a benign growth of smooth muscle. What does that mean in layman's term? Honestly, it means we don't know. Okay, it is a growth of smooth muscle that just happens and occurs. There are many different theories on it. I made my own theory about it, and the way I look at it is like it's almost like a callus for your uterus, right? So like if you go to the gym and you overwork your hands and you grab things, whether you're in the gym or you do a lot of like manual labor with your hands, you start to develop calluses on your fingers. I look at that, as the uterus, because the uterus is consistently moving. It's a moving muscle. And therefore these outpouches or growths can occur. Why doesn't everybody have them? That's the part that we don't know. But I think that's the reason, or that's the start of why they happen, in addition to the reason why they get big and some people get large and others don't, or what have you. One, there's genetic predisposition, right? So you do have a genetic predisposition with your family. Two, we just have different, body types, right? So some people will respond, much differently to hormone than other people. And we just are just different people. So it just really takes that initial event of abnormal growth to happen, and then the response of hormone to that growth, and you have fibroids.
So I think a lot of people hear the word growth, but not, first of all, they hear growth and they're like, oh God, it's a tumor. And that's like, what I said last week was a benign tumor. So
sure.
Yeah. So, but yeah, so fibroids, because we had the patient we had last week, she actually had 2 myomectomies. They were 15 years apart.
Mm-hmm.
So I know that you do a really, really awesome procedure that hopefully they will not grow back, correct?
Hopefully. But as I say all the time, like, the uterus is a playing field, right? It's your playing field for pregnancy. In that playing field, you can have barriers that come on, which are fibroids. As long as you have that playing field in your body, you can have these barriers or hurdles that come and attach themselves to your uterus. So you can have a myomectomy, but to try to 100% assure that fibroids will never come back, no one can do that. Fibroids have a mind of their own. Now, I will say that, with surgeries, with thorough surgeries, with myomectomies, that it is very unlikely for them to come back. And that's one of the reasons why I have discontinued doing laparoscopic myomectomies, even though I'm a laparoscopically trained surgeon. I'm a DaVinci robotic. I thought it went out. So not only am I a robotically trained surgeon, I'm actually a proctor for DaVinci. I go out all across the country teaching DaVinci robotic surgery. I also, I'm laparoscopically trained to the 10th. I'm one of, from a gynecologic standpoint, I am an extremely good laparoscopic surgeon. With that being said, I am not a proponent of laparoscopic myomectomies. Couple of different reasons. And people always say this, well, why you got to cut them open? Why do you do this? Why did it? Why can't I have this? Couple of different reasons, right? Number one, any of the, and I've done extensive fibroid surgery, hundreds, maybe even thousands of patients with fibroids. The ones to my memory that I can remember that I've had to come back for with fibroids in the future have been with laparoscopic surgery. Why is that? Because you lose your ability to palpate or feel, right? So when you do laparoscopic surgery, you're operating through small holes, through instruments. So for the most part, you can only get what you see. But fibroids are all shapes and sizes. I pull out fibroids that are the size of a pin top, the size of a marble, the size of a pea. All of those fibroids, if they're embedded in the uterus, if you're going in with laparoscopic surgery, you're not going to be able to see them, and they will stay. If they stay, they can easily, a marble can grow into a softball very easily, right? So if I want to be able to palpate or feel the uterus. So when I do my myomectomies, I'm literally in there for 45 minutes to an hour, just feeling the uterus, making sure I got every particle of fibroid out of it. And then also perfecting a procedure in which it's a small scar, where quick recovery, quick healing, but we'll talk about that later. The other reason why I am a proponent of myomectomy open, as well as preferably open over laparoscopically, is because everything you do has to make sense, right? It's a fact that if you perform a myomectomy with extensive damage to the uterus, meaning that I have to pull these big masses out of the uterus and then repair them, then the risk of uterine rupture with delivery is 4 to 6%, right? So we're going to do so if we're doing a laparoscopic surgery, we're doing a surgery that's not as efficient as an open myomectomy, right? And it is now to the point where once you do it, you're going to have a C-section anyway, because your risk of rupture for delivery is very high. So why the risk and the benefit of the risk of leaving fibroids behind, performing a longer surgery and having more complications through laparoscopic myomectomy do not outweigh the benefit of getting all of the fibroids and getting a scar that will be able to be utilized for a C-section in the future. So very long-winded answer, but it's complicated. And it's taken me years to come to that point of understanding that if you are going to effectively treat fibroids, you have to effectively really treat them or take them out.
So it's funny you say that, because last week's guest had a laparoscopic and then had to have an open 15 years later.
Yep. And I see it all the time. I hear it all the time. I see it all the time. When I hear patients say, I had a myomectomy, I got big fibroids, come back, 9 times out of 10, they had a laparoscopic myomectomy.
Wow. Okay. Well, who knew?
And if they had an open myomectomy, this is the problem too. I see a lot of surgeons that are just not very thorough in doing it. It's very tedious. It's tedious to sit up there for 45 minutes and just sit up there and just feel a uterus. Like I've taken out all fibroids out of uterus before and literally felt on it for 30 minutes, 35 minutes, and then I would feel like small specks and pebbles that I had to take out. But it's really being persistent and patient with it to give the optimal results with the surgery.
Okay. So we have a question already. How often should we get checked to see if they grow back? I had a myomectomy around 10 years ago. I had 2 kids after I had the myomectomy.
You should not. And answer to that, right? So I caution people from doing routine ultrasounds to follow things, right? We don't, as physicians, it's important that we treat symptoms in patients and not labs, right? Because if I do an ultrasound on you and now it says you have a 2 centimeter fibroid, what are you going to do with that information? And then what if it's 3 centimeters? What are you going to do with that information? 4 centimeters? What are you going to do with that information? It's not doing you any bit of good. What I care about is if you come and say, doctor, now I'm starting to have increased bleeding. Now I'm starting to have pain with intercourse. Now I'm infertile. I'm having frequency of urination. I'm looking for your symptoms when following up from myomectomy, or even before you even talk about like searching for fibroids. I don't care. Like if you come to me on a regular, I'm not giving everybody ultrasounds to look and see if they got fibroids. We already know 8 out of every 10 Black women have fibroids. So it's not going to be shocking if
Right.
many people have fibroids. I don't care about that. What I care about is you coming in having symptoms, and then I go look forward to see if those are problems.
And that's what I said. I said, if they don't bother you,
Leave them alone.
don't bother them.
Leave them alone.
Yeah. And so I'm in, you know, a lot of people. Oh, and you know what? The patient also said when before she had the second myomectomy, a doctor immediately told her she needed to have a hysterectomy. She was 39.
I see it all the time. I try to educate as much as I possibly can. Excuse me. I try to educate as much as I possibly can, but you know, it's now it's on us. Like we have to take our care in our own hands.
Yes.
The education is out there. We have to be able to utilize it and hold doctors accountable, right? I tell patients all the time, don't just look at, oh yeah, this doctor had all of these rave reviews on Google, you know, or you know, oh yeah, these, you know, these such and such said this or whatever. Do your own research, right? Do your own research. If your doctor, like, you know, I deal with fibroids. When you go to my page, what's on my page? Fibroids. You know, the Fibroid Slayer. I talk about fibroids. I go teach fibroids because I'm passionate about that, right? I'm passionate about women's health. So if you are looking for a provider, why would you not look at their social media is like one of the greatest tools in the world right now. You know, why would you not utilize it? So it's different than, you know, 40, 50 years ago, where it's like you just had to take people's word for if a doctor was good or not. No,
right.
Now you can see it. Whatever they are about, it should be reflected in their personal life. It's reflected in mine, right? So, and that's what I would hold people accountable to. See what their old patients are saying. See what their philosophies are about what you're saying. Do they make you feel comfortable? Are they listening to you, right? Are they answering all your questions? All of these things are more important than what what you look on the internet and somebody says about them. Like, do your research. Take your own care into your hands.
Right. And that's why I always say, and this was a white male doctor, and this is why we say there has been research done that Black people get better treatment with doctors that look like them.
Absolutely.
That is a proven fact.
That is
now, granted, not all of us, you know, are great doctors, but there is a good chance that you will probably get the right answers from a Black doctor. And I think she talked to like 4 doctors after him, and all of them said no immediately that she did not need to have a hysterectomy.
Absolutely.
So clearly that was not the right.
You want proof? Where are the overwhelming majority of hysterectomies performed in the United States?
Oh Lord, in urban communities.
2/3 of them are performed in southern states.
Oh wow.
Okay, so
yeah,
this, you know, it's you have to go deeper into the history of our country. You have to go deeper into understanding how Black women have been treated throughout centuries of this country. Like, we would not have modern medicine of gynecology without the brutalization of Black women, right? On Black women's backs, there were if you want to read something, like read like medical apartheid, read like some of the early accounts of how they learned how to do hysterectomies, how they learned how to do C-sections, how they learned how to do pelvic floor repair, how they literally were holding women down, right? A group of white men were holding women down and cutting on them and doing those types of things. So understanding that, and understanding that we're not far from those times, right? So the bias is not, and the racism and all those things we're not far removed from it. So it's not happenstance that you have all of these problems happening with our women. With that being said, you know, now we can't expect anybody in the masses to look out for us. It's already been shown. Like, it's not, they're not going to change it, right? So with that being said, we have to take it on ourselves to change it for ourselves. And the first thing we have to do is educate ourselves.
Right.
Once we become educated about things, people can't take advantage of you. People can't do things because I know what you're telling me is wrong. You know,
Right.
I know that I talked to this doctor and they said that, and I hear what you're saying, and it just isn't lined up. You know, you have to do that. I had a consult with a woman today. She told me, she was like, I'm like your 6 or 7 doctor. I'm the 6 or 7 doctor she talked to. Applaud.
Exactly. I was just going to say,
Absolutely.
please make sure you get a first, a second, sometimes even a
Absolutely.
third, fourth opinion.
Absolutely. I have people that are calling me from other countries. I had a lady called me from Canada. They just said, you know, I've had 3, 4 doctors up here. I know I can't come and see you, but I want to hear what you have to say. Do your research. Do your research.
And, you know, why don't you let people know how could they do a consultation with you?
So www.docforthestreets.com. So DOC, the number 4, DASTREETZ.
So that is in the post, you guys, but I'm going to put it on the screen. But
Yeah.
I did put that in the post.
It's phonetically incorrect on purpose because, you know, that's my whole platform. That's my function. I want to be authentically myself, number one, and I want to always be personable for people to not feel that they're being talked over, right? To be able to talk like you are at a family reunion or like at the kitchen table or whatever, somebody to talk to you and break stuff down to you so that you understand. And that's how good care happens, because therefore you feel comfortable to be able to tell everything that's happening and what's really happening. And as a physician, if I have that comfort level from you, I know that you're not hiding anything. I know that we have that rapport.
There'll be no surprises.
There's no surprises, right? And then the relationship is formed, and we're able to optimize care that way. So that's my whole thing. You know, I just really try to make people understand that communication is key, and trust and honesty about, you know, what you're doing is very important.
So real quickly, can you tell us, how did you decide to become an OBGYN? Most people know that I've worked with the twin docs for years, and they are 2 male OBGYNs as well. Yeah. And I've heard their story obviously a million times, but what about you?
In a nutshell, long story short, you know, when I was a kid, like I'm from the south side of Chicago. I wanted to play professional sports. I had an aunt that challenged me and just said, you know, you got to do something different. Like, what you got to give me something else. You can't just be playing professional sports as a career. And you know, I thought about it, and after a couple of weeks, I said I wanted to be a doctor. Why did I say that? Only positive thing around me was the Cosby Show. He happened to be an OBGYN, so that really kind of sparked it in my young mind. When I was 9 years old, my brother was born. It was really fascinating, like childbirth, the entire thing, like from pregnancy to birth, like was really, really just jaw-dropping to me, the physiology of it and everything to it. So I was like, that's what I wanted to do. And then from there, you know, a couple of other different things happened. I started cutting hair when I was 14 years old. I learned that I was really, really, really good with my hands. I worked in a barbershop, you know, became a master barber. And then just understanding that that I'm really good at surgery because of my dexterity. So understanding that the gynecological aspect of OBGYN is one big need, but it's two, a way that I could impact medicine and impact my community. So for me, it was just like, you know, a perfect mix of things in which way I can impact my community.
Wow, that's awesome. So he is one of 3 people that wrote a really awesome book that I've actually read. It was very good. So here's the website for the book, so you guys can check that out as well. And I put the link to his Instagram in the post, so you can follow him on Instagram. But please, what are some final thoughts on fibroids and women making sure that please touch on, because I think a lot of people don't realize that they have that they're heavy bleeders. They just think I'm supposed to be missing 4 days of work every month.
Got you. So I'll give you 3 major points. Number one, have a physician that really understands bleeding and fibroids. The misconception is that abnormal uterine bleeding is always from fibroids, and that is not the truth, right? Because as you get older, every woman, I don't care who you are, your production of hormones is going to start to decline. It's just in the nature of the beast, right? So if you are post 40 and you're starting to, out of the blue, start to have abnormal uterine bleeding, and they just so happen to do an ultrasound and it shows you have fibroids, don't just take it for face value that fibroids are the reason, right? Really have somebody to understand if that's truly the reason or not. Because I can have a 42-year-old woman with horrible fibroid disease, with horrible bleeding, and I can have a 42-year-old woman with no fibroids whatsoever and also have horrible bleeding and horrible cramping, right? So just understanding that fibroids are not the culprit for all things that are problems with women. It's number one. Number two, know your options, right? Don't let anybody tell you that you don't have an option, right? If somebody tells you like hysterectomy is your only option, get up, leave, walk out the door. It's not your only option. It may be your best option, but it's not your only option. You always have options, right? And me personally, I give people my opinion at the end. I'm going to tell you what I would tell my mama. I will tell you what I tell my auntie, what I would tell my sister. I just delivered my sister's baby 7 months ago. Like I take care of my family. So I'm not going to tell anybody that I would not tell my own family. So if you are doing something that, or you want a real option that maybe not be in line with what I'm thinking, I'll tell you what I'm thinking. But at the end of the day, it's your choice. It's your body. It's what you want for your life. And as your physician, as your surgeon, I have to honor your wishes, right? Whether it's popular opinion or not. Don't let anybody force their beliefs or whatever they think on you. They need to educate you thoroughly so that you can make an informed decision about your body. Number three is if you and trust me, I don't want anybody to ever take this the wrong way. So I try to say it so that people understand. I am totally woke and aware and understanding of the history of our country and what Black women have went through, and what they're still going through. I am totally woke and aware and understanding that hysterectomies are thrown out like tonsillectomies or wisdom teeth removals. Like the doctors are just forcing women to have hysterectomies left and right, and that they are doing horrible surgeries and leaving women with all types of issues and problems. Trust me, I understand. The stories of our women that have come before us, our aunts, our grandmothers, our great grandmothers, of these horrible procedures, being down for all of those things are true and valid, and people should have concern, people should have fear, people should have apprehension about the word hysterectomy and about the surgery in of itself. With that being said, hysterectomy is not always a bad option, right? Because if you have a doctor that understands everything and is doing everything possible to give you the best option, and not only that, is taking their time to worry about how your scars look, how your belly looks, how you are going to recover after surgery, how you are going to get back to your family, how you're going to get back to work. They're concerned about all of those things. If they're concerned about all of those things, then you have to realize that they have your best interest at heart. And sometimes hysterectomy is the answer, because I can do a robotic hysterectomy and remove your uterus and your cervix, end your bleeding, never have another fibroid. You're out of the hospital in less than 24 hours and you're back to work in 1 to 2 weeks. And we could choose to do a myomectomy and you are, in the hospital for 2 days, not back to work for 4 to 6 weeks, have a longer recovery time or what have you, just for the fact of saving your uterus. It doesn't make sense. If you're going to save your uterus, have a purpose for it. Right? Nobody should ever tell you that you need to have a hysterectomy just because of your age or anything else. However, on the same token, no one that is, I don't care if you're 35, 40, 45, however old you are, if you have fibroids, bleedings, and other issues, and hysterectomy is on the table, if you do not want to have a hysterectomy and you want to preserve your uterus, there should be a reason for you to preserve it. If you're going to go through all of that, you need to use it, or you should use it. Maybe not need to, but they'll use it. A lot of women have it in their mind that You're not going to be a woman anymore, or like it's like all of these bad things are going to happen. You're going to start growing hair. You're going to start to do male type things because you had a hysterectomy. All of these things are false. Understand what a hysterectomy is. Understand the terms like partial, complete. All of those things are bad terms, right? A hysterectomy is just removal of your uterus and your cervix, right? Your ovaries control your hormones. As long as you have your ovaries that are still there, it does not, you know, your when you go into menopause, you're going to go into menopause. If you remove your uterus, everything else is going to be normal, except you're going to not have bleeding and not have fibroids. So again, just understanding that hysterectomy is not always a bad thing, and having trust in a physician that is going to have your best interest at heart and explain all of your options totally, and give it to you straight. You know, those are the things that I would say. Well, I know that's a lot, but
it's good.
I get to talking and I just get to rolling.
No, it's good. It's great information. And so like I said, go to his website if you need to have a consultation with somebody who is a fibroids expert, because just because you have a doctor that's OBGYN doesn't mean that they operate on fibroids as much as he does or somebody else does. So you want to make sure that you're going to somebody who this is what they see on a very regular basis. So make sure that you definitely check the website. Pulse of P3. It's a book with 3 physicians, 3 male physicians, 3 Black male physicians. So please check it out. It's a really great book. And if you have young people in your life, it might be something to give to them. They all met at Xavier, right?
Yeah, and we give out a monthly scholarship every single month to young, driven, dedicated kids that want to do something great and are doing things that are great. We highlight, you know, young Black excellence all over the country. We've been giving it out. Every dollar that we've gotten from the book, we've given it back to scholarships. We just, thank God, we just got this large grant in which now we can go forth with our mentoring app, which we've been really pretty much in the works, and now we can go full forward with it. But it's just a great effort. You know, go to the website and check it out for everybody. As far as like just education, I'm really I'm strong about education. We spend so much time looking at nonsense and putting our time and stuff that really doesn't matter. Like, take some time to look at stuff that matters. I'm not just putting my social media out there, but you know, my social media is just strictly for pretty much education, right? I'm educating people about their bodies, about their lives, how to you know, educate themselves about how to get better care and how to find access and end healthcare disparities. And the only way to end healthcare disparities is through education. So all my platform is educate women about their bodies and their options for better health.
So yes, so please make sure you follow him. Tell a friend to follow him as well. And what med school did you guys go to? Did you guys go to the same one?
No, we didn't.
Okay.
I went to the University of Illinois, and Joe, he went to Cayman Islands. He went to med school in Cayman Islands, and Max went to Howard.
Okay. But yeah, please, you guys, check out the book. It's really great. And of course, like you said, you buy the book, you help with the scholarship. So it's really, really cool. But thank you so much for your time this evening. And please continue I actually saved one of your videos about COVID. I sent it to somebody. Go, see, this is what I'm saying. He was like, take the time to go and get the information from an actual physician and not
man, it was crazy. It's like,
it was hilarious.
I was like, how, like you really, I'm like, it's people on there that have literally spent 6 minutes on a Google search and want to argue with me about, you know, something I've been doing half my life. I'm like, come on, man, what are we talking about here? Like, really, people, they don't hear nothing else. Like, really look at who you're getting your information.
That's what I was gonna say. Education is great, but you got to make sure you pay attention to the source. You cannot just pick any old body to listen to. You have to pay attention to the source.
I don't come to me if you need a mechanic. If you need your car fixed, don't come to me. I'm not that guy. I'm not going to play like I'm that guy. So with that being said, why are you going to buy like fibroid blaster pills from somebody just that does not have like some type of advanced science degree or care or experience with caring for women and fibroids? Just think about it. Just think about it. That's all I gotta say.
And I mean, and there is so many people out there that somehow get these platforms.
Oh my God.
There's a video on the Breakfast Club. I'm sure you've heard about it too. And I was just like, what are they talking about?
You talking about the lady with the iris? Talking about the eye?
And there was a gentleman too, though, that said women aren't supposed to bleed. And did you see?
Oh yeah, I didn't have it in like with Brother Polite and everything else. Like I was like, man, come on, man. Get out of here, man. Stop talking. And y'all, and then people will be like, they'll argue with me about it. I'm like, how you gonna what are we talking about here? It's like, you think that these people are just giving me the degree because I'm just there? Like, what are we talking about? Golly. I digress.
Yes. So you guys, please pay attention to the source of where you're getting the information. But here I'm giving you a great source. Ladies, please follow him. I'm telling you, great information. He explains it. Google University strikes again. Exactly. Somebody just posted that. But yes, he gives great information, and it's factual information, and he gives it in a way that everyone can understand it. So there is no problem. He's not doing a whole lot of medical talk. He's speaking so that you can understand it, and you'll have information to take to your doctor. Your doctor will appreciate if you know what you're talking about. When you come and you sound like you came from Google University, we can tell right away.
100%.
So it's better to get the information from somebody who actually has a degree that they earned and knows what they're talking about. So please, you guys, follow him. I'm telling you, you won't regret it. And I must have you back again for something else. We'll figure it out. But thank you so much for your time this evening. And you guys, I will see you next time.
Anytime, Dr. May. Thanks for having me.
No problem.
See you guys later. All right, bye-bye.